Traumatic brain injuries, including mild traumatic brain injuries, mTBI, are a major problem for children. This injury leads to pathophysiologic injuries and associated symptoms that can result in poor physical, cognitive, or psychological function. In this video, we'll explore the current diagnostic criteria and unique considerations for mTBI in children. In 2023, the American Congress of Rehabilitation Medicine, or ACRM, published an updated diagnostic algorithm for mTBI that includes 6 criteria. Criterion 1. There must be a plausible mechanism of injury reported through direct observation or witness report. This may include an external force to the head or to the body that causes the brain to move back and forth, or a transfer of energy to the brain from a blast or explosion. If a plausible mechanism of injury is established, healthcare providers should review the other criteria in the algorithm. Criterion 2. 1 or more clinical signs that present immediately after the injury. These may include loss of consciousness, alteration of mental status, such as acting confused, disoriented, or dazed, complete or partial amnesia, acute neurological signs, such as motor incoordination or seizure. Criterion 3. 2 or more new or worsening acute symptoms that present immediately after or up to 72 hours post-injury. These may include alteration in mental status, physical symptoms such as headache, nausea, dizziness, or balance problems, cognitive symptoms such as feeling slowed down, difficulty concentrating, or memory problems, emotional symptoms such as emotional lability or irritability. Criterion 4. Abnormal clinical examination and/or laboratory findings. This may include cognitive impairment on acute clinical examination, balance impairment on acute clinical examination, oculomotor impairment or symptom provocation in response to vestibular oculomotor challenge on acute clinical examination, elevated blood biomarker levels indicative of intracranial injury. Criterion 5. Abnormal neuroimaging findings. If completed, this would include intracranial abnormalities on CT or MRI. Criterion 6. Findings in Criterion 2 through 5 are not better accounted for by pre-existing or co-occurring conditions. The ACRM diagnostic algorithm also indicates that patients who have a plausible mechanism of injury and 2 or more acute symptoms, or 2 or more clinical or laboratory findings, but do not meet other criteria sufficient for diagnosing an mTBI, should be diagnosed as having a suspected mTBI. And a patient should receive a diagnosis of traumatic brain injury instead of an mTBI or mild TBI if they experienced a loss of consciousness greater than 30 minutes post-injury, have a Glasgow Coma Scale, GCS, of less than 13, 30 minutes post-injury, experience post-traumatic amnesia for greater than 24 hours post-injury. Future definitions of TBI will likely include a new classification system that moves away from the traditional mild, moderate, and severe classification scheme. Now let's explore the series of events leading to a pediatric mTBI. An mTBI is associated with a force or an impact to the head or body that causes the brain to accelerate or decelerate with translational and angular forces. These translational and angular motions stretch the neurons, triggering a complex cascade of ionic, metabolic, and physiologic events, often resulting in microscopic axonal dysfunction. So why are mTBIs in pediatric populations especially common? Reason 1. A developing brain. Children's brains are still developing, with less white matter, myelination, and synaptic pruning. These factors make children's brains more susceptible to stretching, as well as chemical and metabolic changes associated with mTBI. Reason 2. A developing body. Children have less developed musculature, including cervical and shoulder muscles, making them less able to absorb mechanical energy. Reason 3. Curiosity. Children are naturally curious and engage in more risk-taking behavior. While this trait supports learning and development, it also increases the risk of injury, including mTBI. Most children who experience an mTBI will have a good recovery. But for some, an injury to the developing brain can disrupt a child's development and negatively impact behavior and cognitive skills, potentially altering developmental trajectories across multiple domains. As a healthcare provider, your role is crucial in providing the best possible medical care to children affected by mTBI to ensure positive outcomes for their long-term recovery.